different. So it's different for everybody. No two people will grieve in the same way, and no two children and no two adolescents will grieve in the same way. So it's really important that children and adolescents are given permission and allowed that their unique experience of grief, that their unique fingerprint of grief and a loss is allowed. So we've got quite an age range to cover today. So what I've done is I've divided it up into developmental stages. So some of you will have children in one of these developmental stages. Some of you might be caregiving for children across a couple of these. So I thought the easiest way would be to divide it out by age and go through the developmental stage, what the child will understand in terms of the concept of death, and then common physical, behavioral, emotional, and social grief responses that you can expect at each of those stages. So our first stage there is children aged 2 to 4. So children at this age are very concrete thinkers. They're very much in the here and now, and in a physical sense, they don't understand abstract concepts like life and death. And children primarily express themselves through play at this developmental stage. What do they understand in terms of the concept of death? Well, they'll see death as reversible. So when is mom and dad coming back? When might I see the person again? And they see it as universal. So who else is going to die? Will you die? Will, granny, granddad, somebody else die? So some of the common grief responses that you'll see is a general anxiety. So lots of worries across the board, maybe play, school, home, and in different environments. An increase in crying. Irregular sleep or disruption to sleep. So maybe difficulty going to sleep, maybe nighttime waking and seeking comfort. You can see an increase in clinginess or needing to be held. And they might be more irritable, less patient, and might have more temper tantrums. It's not uncommon for children at this stage to tell the story of what's happening in your family to anyone and everyone, including strangers. And at this stage, there can be lots of questions and repetitive questions, and that can be quite challenging for parents and caregivers. But children do that in order to help themselves process the information. And you might see some behavioral regression. So tasks and skills that children have already mastered, they might regress on. So they might ask to be fed. They might look for a bottle or a blanket that maybe they've already transitioned out of. So going back to an early stage of development. Between the ages of 5 to 8 then, very much children are still in the concrete thinking phase up until the age of 8, but they do have a desire to be more independent. So you might hear things like, I'll do it myself, or I want to do it myself, or I can do it. But they do have a tendency towards magical thinking. And what I mean by that is that they may imagine that something that they've done or something that they have said has caused the person to die. So they might say things like, it's my fault, I was mad and I wish that she died, or if I had been better behaved. And they also often will see death as still reversible. So you might get questions about, when is the person coming back? When will I see them again? And just like our earlier group, there can be changes in sleep, going to sleep or during the night, early wake. They might also experience this change into eating habits, so eating less or eating more. Again, repetitive questions. At this age, they might become concerned about the safety of others. So worries about, is everybody else safe? Worrying about people going to work, going to school, and worrying about when people are coming back. Are you coming back from work? Is granny going to come back? Aunts, uncles. You might see short periods of strong reaction, so big emotion, 1 minute, and then acting as if nothing has happened the next minute. Regressive behaviors, just like the children in the 2 to 4, they may go back, they may want you to feed them, they may want to be cuddled, they may want to be held, may revert back to an earlier developmental stage. Behavioral change, so you might see an increase in energy, might be quite high in energy, or you might see that they're quite low in energy. You might do things like hit, kick, break things in order to express their anger. And at this stage, they might express physical complaints. So really common physical complaints would be sort of tummy ache or pain in the tummy, headaches, or just general body aches or muscle ache. For children then aged 8 to 12, Some children in this age group, they're on the cusp of that concrete thinking, but they are beginning to be able to understand abstract ideas like death and grief. Children at this age begin to understand that death is permanent, and they really begin to start thinking about how it will affect them over the long term. So if mum or dad or their loved one isn't there, what will that mean for them in the long term? At this stage, it's not unusual for children to focus on the details of what happened to the body of the person. So what happens to the body when we die? What happens to the person? And they can also, again, have feelings of guilt or regret in this sort of magical thinking phase, concerns that something that they did or something that they thought somehow made the death happen. So it's really important that children are explicitly told that what has happened is not their fault. Children will primarily express their feelings through their behavior. They can become very anxious and concerned for themselves and for others. This sort of hypervigilance around safety, is everybody okay? Because they have a view of the world when something happens that maybe the world isn't a safe place. So this hypervigilance is them trying to regulate those thoughts and emotions. You might see that they have difficulty concentrating and focusing, and that can particularly become apparent in school. So it's always really helpful to check in with teachers how they're doing there, how's their attention, how's their concentration. Again, disruption to sleep, including nightmares, and that holds true for earlier groups too. Those earlier stages, children may have nightmares or night terrors. Again, the physical complaints, headache, tummy ache, sore bones, sore muscles. Children will often at this stage use play to recreate the event. So using teddies and dolls, maybe play in hospitals. Some of those characters will die and in those games. And that's a really normal part because that's how they communicate, through their play. But it obviously can be quite upsetting for parents to witness. But it's not something to worry about. They'll have lots of detailed questions, and this can be quite challenging at times about who, how, what, where, when. They'll experience a wide range of emotions, so anything from rage, revenge, guilt, sadness, relief, worry. And it wouldn't be unusual for children to have an increased sensitivity to light, to noise, to movement, or to change, or for them to begin to withdraw from social situations. So our final group then are the teenagers or adolescents. So this is children aged between 13 and 18. So at this stage, adolescents cognitively understand processes and abstract concepts about life and death. And identity is very, very important to them, as are their peer groups. They understand that death is permanent, but they may still have some unspoken magical thoughts, like, for example, that the person has gone on a long trip. At this stage, they may also delve into questions about the meaning of life and death and other traumatic events. Why has this happened to us? Why has this happened to my person or loved ones? So developmentally then, children at this age group tend to withdraw from family and support networks and really focus on their interactions with their peers. Children at this stage may increase risk-taking behaviors, so drugs, alcohol, unsafe behaviors, reckless driving, that kind of thing. Again, may have difficulty with concentration and attention, easily distracted, particularly in school environments. Alternatively, children at this stage might push themselves really, really hard, so become really, really focused on schoolwork or the gym or activities that they're in and really push themselves to succeed as a way of coping. Sleep difficulties is common across all the age groups. As we've seen, often children can be very exhausted because there is an awful lot emotionally to process. Again, a lack of appetite or eating too much, unpredictable and intense emotions, anger, sadness, guilt, relief, anxiety. It wouldn't be unusual for teenagers and children to be uncomfortable discussing the death or their own experiences, and they can find it hard to open up. Again, anxiety is a common grief response across all the age groups, or worry or hypervigilance, worry about other people dying or other people being unsafe. Lots of confusion at times over role identity in the house, particularly if the death has been of a parent or a caregiver. and they might attempt to take on that role. So caring for younger siblings, trying to make decisions. They may have thoughts of suicide or self-harm. And again, they may experience increased sensitivity, sensory issues around noise, movement, light, touch, all of that kind of thing. So they're just some of the physical, social, emotional, and behavioral grief responses that children can experience. So I just have a slide here around talking to children, and I'm going to briefly go through that. So it's really important that we encourage children and adolescents to talk about their grief, because this helps to normalize it for them. Grief is a universal experience, but unfortunately, there are some children and adolescents who will experience that much earlier in their life and won't have had experience of it. So it's really important that we encourage them to talk about it in order to normalize it. And to encourage questions, particularly with adolescents who may not be forthcoming with questions, or younger children, depending on the child's personality. So saying things like, it's okay to have questions, I'm going to answer any questions that you have, and checking in that whether they have questions or not, or inviting them to ask questions. Sometimes it can be helpful to think about possible questions that they might have, and just to spend a little bit of time to think about how you might want to respond to those. Think about the words that you might use and what might be best for your child. Be prepared that children can ask questions at any time of the day. And it may not always be a time where you're available. I'm going to talk about that in the next slide, what can be helpful there. If talking about the subject is painful for you or upsetting, or you find yourself getting upset, that's okay. And it might be really helpful to tell them why. To explain to them that it's not them bringing up the conversation that's difficult, it's that you're upset about what's happening in the family, and that it is okay to talk about. And it's okay for you to express emotion in front of them. That helps them again to understand that these are normal reactions, and you are modeling that for them in those moments. If you're not sure what your child's question means, be curious and reflect the question back to them. And this can be really, really helpful. So saying things like, that's a really good question. I'm so glad you asked that. But I'm not really sure. Let me think about that. What do you think about that? And then you can build on that when they give their answer. Oh, I was thinking the same thing. Or I never thought about that. It's just to give yourself a moment, because sometimes the questions that children can ask might throw you a little bit in terms of how you want to run. So asking them back, because that will give you also a sense of maybe where they're at, what are they thinking, what are they feeling, and it can open up the conversation in a really nice way. Be prepared for more questions when the child has taken in the answers that you've given them. And this can be quite challenging for parents, because children tend to ask the same question over and over and over again. And it's normal for parents to feel like, God, I've answered this so many times. This is actually the child's attempt to try and process and take in and make sense of what's happening. And they reassure themselves by asking those questions. And this is probably the most important one, is that you don't have to have all the answers. And it is okay to say to a child, if they ask a question, if you don't know the answer, I don't know. That's a really good question, but I don't know the answer to that right now. But I tell you what, I'm going to try and find out. And if I find out, I'm going to come back and I'm going to tell you. And invite them to remind you. Will you remind me to come back to that question? And I'll say, and if you still don't have the information and you don't know, it's okay to come back and say, I don't know. Maybe that's something I've been wondering about as well. Children will accept those answers. What they want is honesty from parents. So it's really, really important, if you don't know, to say, I don't know that. So setting the scene when we're trying to talk to kids about grief and loss, so a quiet space. The timing is very important, because children will bring up questions at any time of the day. If you don't have the time, it's okay to say that, so that you're not rushing it, or you feel like you're not present, or you've been caught off guard. So you'll say something like, I'm really, really glad that you asked that question. That's a really important question. And I really want to give you my full intention. Would it be okay if we talk when we get home, or when we're on our walk, or whenever it might be? So making a plan and remembering to follow through. Trying not to have the conversations too close to bedtime can be really helpful. And I know that lots of children will bring up the questions and conversations going to bed. So it's not, so we should answer them at that time as well, but trying to encourage them maybe earlier on in the day to have that conversation. Conversations tend to happen more naturally when you're doing something. So when you're side by side, or not that intensity of sitting across a table or in a sitting room. So in the car is always great when children are talking to the back of your head rather than feeling the intensity of having to look at you. So they find that they'll often open up maybe when you're out for a walk or reading or doing an activity together, whether it's colouring or playing a game. It can be really helpful to get children talking. Get curious with them. So if you find that maybe they're not talking it so much, or you want to find out a little bit more, you can initiate the conversation with, I was remembering such thing, and I was wondering what that was like for you. Or I noticed that you were quiet when such and such thing happened, or such and such thing was said. And I was wondering, I was trying to imagine, what did you feel like, or what were you thinking? And that can invite them and give them permission to open up. It's also okay to revisit an earlier conversation, to talk about, go back, particularly if there were questions that you couldn't answer, or to go back and, I've been thinking about what you said the last day, and I was just wondering. Model the feelings. So again, this is around normalizing and validating the feelings for children. I was really scared when such and such thing happened. How did you feel? Were you scared? I was really afraid. I was really worried. Okay, so help them to understand grief. And I suppose this is particularly relevant to our adolescent and teenage group. So you'll see on the left the ball of grief, or the tangled ball of emotions. And this is really helpful for teenagers to see that there is a huge range of feelings or emotions in grief. And they are tangled up like a ball of wool or a ball of twine, and they overlap and they take different twists and turns. And you'll see from the image of the right that very often the first one is how we would want grief to work, that we would get from point A to point B. But the second image is how it actually works. And it's very messy, and it's really reflects that ball of grief emotions on the right-hand side. There are lots of ups and downs and lots of twists and turns. And it can be also helpful for teenagers to know that whilst most people think that grief gets smaller with time, in reality, it stays the same size, but life begins to grow slowly around it. And the red in that image presents the grief, because often children will worry about what life will look like after there's been a death or loss in the family. What will life look like? Will life ever return to some sort of normality, or will it be very, very different? Transitions are really important when we're talking about children and teenagers who have experienced grief. So regardless of the amount of time from when the death or loss has occurred, transitions can bring new waves of grief. And you'll often see that when children are transitioning from primary into secondary school, and indeed from secondary into college or university or work or further education. Puberty can be a really significant time that can bring new waves of grief, transitioning into adulthood and around other losses. And that can be whether that's friendships, loss of pets, the death of other important people in their lives. So each of these transitions can bring new waves of grief and new challenges for caregivers and children and adolescents. Coming towards the end, so I just thought that I would do a slide around helpful tips. Just like our fingerprint at the start of the presentation, it's important that we understand that everybody grieves differently, and children grieve different to adults. They tend to dip in and out of their grief a little bit more. It's really important that we're honest, and this is probably the most important part of supporting children, is that we provide honest information about what's happening in their lives. And you can build on small pieces of information depending on your child's personality and their stage of development. And it's really important that appropriate language is used. So using the words death and dying, and that we stay away from things like gone away, has fallen asleep, because it can be very confusing for children. Be prepared for ongoing conversations. They need time to process. And again, the repetitive questions. Try and maintain routine and predictability in day-to-day life as much as possible, because children feel less anxious when they have predictability, like adults, and routine. So it's really, really important for them. It helps them to feel safe in the world. If there are changes, you can include them in the decisions as much as possible. Explain why the changes are occurring, why that has to happen. So if somebody else has to collect them from school, or they have to be minded by somebody else, explain why, because you're taking somebody to an appointment, or you have to go somewhere else, and just reassure them that you'll be back, general time that you'll be back. Reassure them of who's there to support them. So the adults in their lives that they can talk to. So they can talk to granny and granddad, they can talk to aunts and uncles, they can talk to family friend, they can talk to mum, they can talk to dad, they can talk to older siblings, whoever it might be, and name those people for them. We've touched on this earlier, that it is okay to model your grief. It is okay to express your own emotion, to cry in front of the children. This helps them, gives them permission to express their own grief. It's important to support them and actively remember their loved one who has died, and in whatever way that feels best for the child. So creating a memory book, planting a tree, blowing bubbles up to the sky, reading stories around loss, lighting candles, just having conversations about the loved person and their favorite memories, things that make them laugh, going through photographs together, whatever it might be that you actively help them to remember. It's very important to have patience for yourself and for them. You are doing your best in very difficult circumstances, and your best is good enough. And it's important to remember that. And I always encourage parents to use that mantra: I am doing my best. It's important to balance behavior management. If children are behaving in a way that's unsafe or that is affecting their sort of daily function, then it's important to intervene, but that we make allowances perhaps for what is expression of grief and emotion and what's unsafe for them. And finally, it's really important to look after your own grief. It's a very, very difficult situation to be grieving yourself and to be supporting a young child or an adolescent in their own grief. So it's really important that you have support for yourself and that you have time to attend to your own grief, to look after yourself. I've just put a slide here on some useful resources. So TUSLA have the top 2 books, Parenting Positively, Helping Teenagers to Cope with Death. And then they have another one for younger children, talking about death and dying from ages 6 to 12. And they're available on TUSLA's own website. Childhood Bereavement website, that is the Irish Network of Childhood Bereavement. And they have lots of resources. The fact sheet there, just on the right of your screen, they have lots of fact sheets and information for parents around supporting children in grief. Childhood Cancer Ireland website, Children's Grief Centre, the Irish Hospice Foundation, the Irish Cancer Society, they all have books. The Irish Cancer Society, I've just taken a book there, Talking to Children About Cancer. That also covers talking to children around grief and loss. And they have another other books if there are children in the family who have cancer. It's a really good website to go on. We have the books available here in Cancer Care West as well. And the final website then is a UK website, and it's shares lots of information and resources around supporting children.